Welcome to the MS&Me Radio Network, a division of the Multiple Sclerosis Global Support Network. The following program broadcast is an original creation by the broadcast entity. Discussion within the following broadcast should be used for informational purposes only and is not a substitute for professional medical advice or consultation. Before considering application of any broadcast content in the following program, please consult your healthcare provider. If you feel you are having a medical emergency, please contact your local health services for immediate assistance. MS&Me Media and the Multiple Sclerosis Global Support Network do not guarantee or warrant the accuracy of information in the broadcast to follow. The Multiple Sclerosis Global Support Network provisions broadcast services to program hosts. Information discussed in the broadcast does not necessarily reflect the views, opinions, or goals of the network and are solely those of the show broadcast host. Should you wish to host a broadcast, please visit our website at msmemedia.com and submit a request to become a program host. We thank you for listening to the MS&Me Radio Network. Enjoy the show.
Hi, welcome to MS Frontiers radio show. Let me introduce myself. I am Dulcie Hill, founding director of MS Frontiers Peer Support Ministry. We are made up of 6 Facebook support groups run by administrators who volunteer their time to serve others with MS through the callings of the words written in 2 Corinthians 12:8 through 10. So let me back up here. MS Frontiers can be found at msfrontiers.org. That's www.msfrontiers.org. And what we do is we all came together and created MS Frontiers. I actually did. I started it because I couldn't find any help I needed back when MS was happening to me. That was in 1993. So because of lack of support and suggestions and the compassion I needed when I was diagnosed, it was just terrible. I felt very alone. In 1994, I remember going to the emergency room with a stabbing headache, and I got a shot of Demerol, which did nothing, and they listed me as a drug addict. Now that headache was tic Duraloo, or tic neuralgia. It's just that stabbing pain that we know people get with MS. But at the time, they didn't know that. So I'd go down to the library and I'd try to find a solution. I'd have all sorts of medical books out. And I found, after reading hours, that it was extremely rare, known as trigeminal neuralgia, and it could easily be treated with Tegretol. So much to my doctor's surprise, when I went back, I wasn't looking for more Demerol or drugs. I wanted Tegretol. This information my doctor didn't know at the time, and before the internet, it was impossible to determine that this was common and often experienced with people with multiple sclerosis. Then in 1996, when I got my first computer, I found an online peer support. At the time, it was called Jolie's Join. And there was a chat program through ICQ. And I got my first partner, who was born the same year, was diagnosed the same year. And she and I have been friends ever since then, from the very beginning. She's not on Facebook or anything, and that kind of saddens me, but we're still very dear friends. Then in 2012, I was introduced to Facebook, and I felt that God had called me to serve others with MS through my affliction. There wasn't there was hardly any MS support groups online, so that's when I started the Facebook group MS Frontiers. And over the years, I've seen brilliant people with MS. It just kind of supported itself, and people were helping me. So now what does the 2 Corinthians say? Now, the Second Corinthians 12, 8 through 10 is when uh, Paul had an affliction, the Apostle Paul. So 3 times he had, it's like a thorn in his side. He kept asking God, will you take this for me? 3 different times he asked God, because he'd be a much better person teaching the word if he didn't have that pain in his side. So he asked God, take it away. But God said, my grace is sufficient for you, for my power is made perfect in weakness. So then Paul thought, well, maybe I'm going to boast. He didn't say maybe. He says, I'm going to boast in my weakness so that Christ's power may rest in me. That is why, for Christ's sake, I delight in weakness, insults, and hardships, in persecutions, and in difficulties. For when I'm weak, then I am strong. So we at MS Frontiers all believe that we have a thorn in our side, and that's MS. Now, in the beginning, many of us struggled, and we had this hate relationship and loathing of ourselves, and just were living in fear, and we couldn't live like that. I've had MS for 31 years, and a number of people in MS Frontiers, the people who volunteer and run it, are doing a great job. They've had MS for a long time too. So we've all had time to make peace with what we can't control. Now we find it's our joyful duty to support everyone who needs help dealing with multiple sclerosis, regardless of their beliefs or religion, regardless of their political views, race, or condition. We do not judge others or tell people what to do. We offer advice that can only come from our own experiences. Uh, Now, the only person in the world that can be offering you advice or should offer you advice is your doctor. We may suggest things, or different people with MS may suggest you ask your doctor about something, but your doctor knows your specific medical history and he knows your disease. So uh, we can't help each other by telling each other what to do. MS Frontiers is blessed to have the leadership of different groups. Of Debbie Harris is she is an associate director and runs MS Frontiers Personal Share. That is a group where if you're having a rough time dealing with MS emotionally, you go there, and we learn how to live with gratitude. Just have a different spin. Um, Doing well. You know how you feel when people come up to you and say how are you doing? Or what's worse, you look like you're doing great. And I just want to tell you, instead of telling them exactly how you feel, if you stop and realize that doing well is a state of mind and not a physical condition of what you're doing at home, how you're feeling, what's going on in your job, what kind of car you're driving. It's a state of mind, and that's how everyone at MS Frontiers has been able to get their mind around. And MS Frontiers Personal Share, Debbie Harris runs that, and she does a great job with it. She also backs me up on anything. She backs up the fellow administrators, and she steps up, where's needed. Marco Martinez is a person many of you have heard of who are listening. He's well respected in our MS community, and he's also administrator. He helped me work through and find this. He's helped me treat my disease or make decisions, and he is our analytical contributor. He also is our detailed person and the voice of reason. Sometimes you get hyper emotional with situations, and he stops that pretty well. Cheryl Watkins Jones is our MS Frontiers primary progressive group leader. She's also just my bosom buddy in faith with Christ. I just adore her. Now, Cheryl runs that group, and that group for primary progressive people, specifically for people who have primary progressive. All of our groups are private groups, and people who want to join are screened carefully to make sure they have reason to be in there. So if you try to join, just answer the questions and prove to us that you have MS or you have primary progressive. None of your Facebook friends are going to know you're in any of our groups because it doesn't show. Only the people in the groups can see what you post. Our other administrators are Judy Kerfoot, who runs secondary progressive MS, and that's another closed group specifically for those of us with secondary progressive MS, and we support each other with progression, losing things. C. Zanks she is our administrator with MS Frontiers Diet Nutrition, and she posts articles about caring for your MS through the things you eat. And she's outstanding. Now, Raluca Ganga is our very own international administrator from the Czech Republic, and she's just wonderful. She posts videos all the time in the group she runs, which is MS Frontiers, Exercise Therapy and Rehab. I also post exercises in there that I also have on my YouTube page. Just if you Google Dulcie Hill, you'll see my YouTube page. And so there's a program that we do one exercise every day. Our newest addition is Melissa Sharp Herlebeck. She's a retired pharmacist and will have great things to contribute in the near future. So we're pretty excited about her. She's really brilliant. So my hopes are with this MS Frontiers Radio is to have each person who volunteers so selflessly with MS Frontiers to spend a half an hour just talking about their expertise or how they serve. It's a wonderful thing. All right, now let's move on to the topic at hand, and that is at multiple sclerosis, the prognosis, what happens when you have MS, and a lot of questions. How can it be treated? You've heard a lot about that new drug, Ocrevus, to help people with MS, but there's specific questions that a lot of people have been emailing me. Well, the first question is Ocrevus a drug that will get us better? The answer is Rituxan, Ocrevus, and all DMDs, disease-modifying medications, only stop new lesions from forming. Unfortunately, this doesn't help us from getting worse when the old damage or the formerly affected nerve that have been affected for 10 to 20, 25 years go into the secondary progressive stage of the disease. This is why it's so important when you have secondary progressive MS to exercise and rehabilitate to keep from losing too much. When your nerves fail, muscle memory can get you through a lot. When you go to fall, it just, your muscles know to hold you. It's just wonderful. Now, what I want to talk about again is it only keeps the disease from, these medications only keep the disease from bumping us out of our remission. So it keeps us from having a relapse. Now, a relapse is something you get when you have relapsing remitting. That's something when you feel a new symptom, you get optic neuritis, and your doctor calls you in a prescription for Solumedrol, or you go in for an infusion to cool down the inflammation caused by this MS exacerbation. Well, Rituxan, Ocrevus, Tisabri, all these medications I have listed on msfrontiers.org with the rate of success, the rate of effectiveness there, they help keep these attacks away. Now, these attacks, say you have these attacks, you get treated with steroids, you feel better, it goes away, but guess what? 20 years later, now you are not feeling as well. You are progressively experiencing these symptoms again. You just feel like you're getting worse. Well, it's because these nerves are just, they're just deteriorating. It's nerve failure in a secondary phase of this disease. Um, that's what that means. If we have nerve failure in the secondary phase, I already talked about muscle memory is what we must depend on. So I discovered that when I had a terrible attack, and I'll tell you about that a little later, but I sat down on the scooter and I relied on the scooter just going around, I think it was a flea market or something. And when it was time for me to get out and stand, I couldn't do it. And the muscles completely stopped working. So even though it's hard as heck to walk sometimes, staying on your feet is staying on my feet is at least I'm on my feet. It may be hard, but I'm on my feet. Let's see. That's why it's important not to have attacks. All right, here's the next question. Are the old lesion that makes us get worse located in the spine that affects our legs, our neck that affects our upper body, and our brains that affect our memory, dizziness, that kind of stuff? Is this why we don't want new lesions that will eventually make us get worse? So my response was, great question. The answer is yes. They are the lesions that cause trouble during the initial exacerbation that sneak up on us and cause disability when we move into the secondary progressive state. I had an attack in 1992. It was my initial attack. It was relapsing remitting disease. I had it, and it caused my left knee just to give out. Well, my MRI showed a huge T7 lesion, which was causing all the problems. So they gave me Solumedrol. It stopped that. My knee started working again, and everything was good. Well, 20 years later, I'm in the secondary progressive state, and it's affected me as follows. Patients with T1 thoracic lesions, thoracic is on your spine. It's the middle section of your spine. They experience a lack of function in their legs or difficulty with their legs, lack of dexterity in their fingers. So anytime you take a top off of a bottle, just throw it across the floor or under a table, because that's where it's going to end up anyway. You can lean over, pick it up, and call it exercise. It also, all kidding aside, that you got to forgive yourself, because these are definitely going to happen. Bowel or bladder problems, function, that's caused by spinal lesion. That is why it's more critical to maintain strength, muscle memory, and most important with bladder and bowel function is behavior modification. So there's medications we can take, but there's a complete behavior modification that'll help you be resilient with these things. All right, so let's move on. What's the difference between active multiple sclerosis and inactive MS? There are two types of secondary progressive MS. One is inactive SPMS, where medications to prevent attacks have no effect at all, because the disease has gone into a typical course and it's quieted down, and taking these medications is just taxing your liver. There's no need to be on them because you weren't having active MS, your disease was inactive. Now, before you make a decision not to take medication, assess your history with your doctor. And think about things like how many times have you had a relapse in the past 10 years? Have you been on disease modifying medications? And have you had attacks while on them? How many times have you had steroids in the past? So if you internote all those, you've never had a problem there, you probably, with your doctor's help, you may be safe not to take medications. Now, the other type of multiple sclerosis, secondary progressive MS, is active SPMS, which does not, which does respond to disease-modifying medications by preventing your more damage from happening. So it's different from relapsing. Well, it's the same as relapsing and remitting in that your disease still is active, but that's the active stuff causes new holes or new scars that when it goes in, when those new scars go into the progressive state, then they're going to cause problem in 10 to 20 years. That will add to your disability. Keeping these attacks you don't want anymore. So the old attacks, which is your old damage, now it's been compromised. These nerves have been compromised so long that now these nerves are deteriorating. So if you only had a few attacks that were disabling in the beginning, then or you had attacks that were very mild there's a good chance that uh, um, you don't need medication. But if you, like with me, they took me off medication for 8 months there, and I had such a bad attack that I didn't know which way was up or down. So in 10 to 20 years, I'm probably going to be in really bad shape. But that's in the future. Right now, I'm just living the most out of each day. Today's a day God has made, and carpe diem, seize the day. So now back to keeping these attacks from occurring may help us prevent new and additional damage, not typical to classic secondary progressive MS, where old damage just seems to get worse. It differs from primary progressive in that primary progressive is active. That's an active disease where you get an attack and it just gets worse. So they still need something that stops their progression. All right, now let me move on to how you treat treat active multiple sclerosis. All right, let me just see. Okay, I was going to tell you more about secondary progressive, but I see that I only have like 5 more minutes, or just a few more minutes to do this. So I want to talk about Rituxan versus Ocrevus. Rituxan is indicated for non-Hodgkin's lymphoma, CLL or chronic leukemia, and rheumatoid arthritis. It's also used as an off-label to treat relapsing remitting. Both Ocrevus and Rituxan are drugs that target B cells, specifically the B cells that have CD20 molecules on their surface. What that means is they both attack and kill these specific B cells almost identically. It's the exact same cell that they kill. Although Ocrevus and Rituxan both target the same cells, they're made up of different molecules and interact with our immune systems differently. So Ocrevus has less of a chance of your body developing antibodies compared to Rituxan. So your body's not going to get used to it. Why is this? Well, Rituxan is an antibody composed of both mouse and human parts. Ocrevus is humanized molecule. The important distinction reduces the chances that MS patients' immune system may form antibodies against the medicine and may reduce, known as anti-drug antibodies, and may reduce the chance that these antibodies will decrease the effectiveness of the medication. So rituximab you can just get used to it and it can stop working. All drugs might be you have the potential of developing antibodies to all these disease modifications. I did on Copaxone, that became ineffective for me, and as well as Gilenya wasn't working for me. So they like to move you on other ones. According to the makers of Ocrevus, Genentech, early studies of Rituxan in MS showed that 28% of relapsing remitting and 24% of primary progressive developed antibodies from Rituxan. Now remember that Genentech makes the competing drug. All right, so now in the Ocrevus trial, percentage of people developing antibodies, only 0.04% of relapsing remitting people and 2% of primary progressive developed antibodies. Again, that's the drug company who publishes that. Now let's talk about safety, which is a big concern. Safety, Genentech, the manufacturers, reported in phase 3 trials that more Ocrevus treated patients developed cancer than those in respective group controls. All right, who's saying that? All right, the drug manufacturers. Studies point out that although more patients in Ocrevus groups developed tumors, the numbers were not higher than what is known to occur in other MS patients. But I'll tell you here, the International Multiple Sclerosis Management practice that they're located in New York, they weighed in on just a non-biased group, and they said since let me see here, they called the number of cancer-affected patients in the Ocrevus trial group alarmingly high. And that's their take on it. So the manufacturers say it's not that high, and the International Multiple Sclerosis Management practice says it's alarming. So taking that in mind, what they recommend is since Rituxan has been used for a long time, plenty of data exists about potential side effects. In an article, February 7, 2010, by Nancy Walsh in MedPageToday.com, from a study at Karolinska University in Stockholm, data from 3,500 patients with rheumatoid arthritis treated every 6 months with Rituxan showed that after 11 years of this therapy, no one had significant long-term risk. The only risk was 5% were at risk for having infections. 5% had infections like pneumonia, cellulitis, or urinary tract infection. However, the infusion reaction is much higher in Rituxan. 25% experience some form of symptoms, which can be controlled by the administering people and nurses in the infusion center. So what is the recommendation by the International Multiple Sclerosis Management practice? They suggest that patients who can obtain rituximab, they suggest that it's safer to continue with this therapy until, with time, they're better able to advise patients about the risk of Ocrevus. So anyway, that's all I had to say today. Come back next week on MS Frontiers Radio, and thank you for listening to me. God bless you, and keep coming back.